In today's health and well-being, it's winter. Do you still need to treat for fleas and ticks? Dr. Wendy King is with Elam Animal Hospital as her assistant. This is Daisy. Daisy's helping you answer questions. You've been online with a lot of viewers, and you can get back to asking Dr. King questions in a moment. First of all, it is winter. Do we need to worry about fleas and ticks? Because let me tell you, 6 or 7 ticks this week on my dogs.
Yes, the ideal temperature for ticks and fleas for breeding and reproductive purposes is 70 degrees, and that's what it's been for the last couple of weeks.
So no wonder we're seeing so many. So the idea that in the winter they're killed off with cold weather is not the case.
It helps in the environment, but also remember, if your pets come into your house is 70 degrees year-round too.
If you have an indoor cat but an outdoor dog, do you need to treat both?
Yes, some of the worst flea infestations that I see are the indoor cats because they never go outside and they're on carpeting, and the carpeting's like artificial grass, and so it's the perfect environment for fleas.
Different kinds. You've got a collar, you've got a topical that they put on, and you also have one that they ingest. What is best?
I think the best thing to do is talk to your veterinarian about which one's best for your pet's lifestyle. I prefer the oral medications like Comfortis and Sentinel. Sentinel's one of my favorites because then you know that the pet got it. With the topicals, you were concerned about your pet rolling out in the dirt afterwards. You don't know if you got it all on, and it might have dropped off some of it, and so if they're ingesting it orally, then you know they got the whole medication.
And it says to do it once a month, but if I extend that to 40 days or every 45 days, is it still effective in those last few days?
I've had that question a lot with the economy because people are asking me if they could skip a month. The problem with doing that, when you put the product on or you give them the medication, it works great for that first month. It's at the level that's going to kill the fleas. What happens the second month is they still have the chemical on their body or in their body, but the chemical's at a lower dose. So if a flea gets on them, it's exposed to that lower dose. It doesn't kill the flea. So now what happens is that flea lays eggs, and those eggs are resistant to the product.
We also have a comb that you can use to comb, like as you did Daisy, to see if she has fleas.
I was going to show you the rump. The rump is the place where the fleas hang out. And I challenge people to test your pet to see if it has fleas, because I'm amazed at how many people say their pet doesn't have fleas. Get a flea comb, $1 at the dollar store, comb it right there, and you'll see it.
All right, excellent advice. Go back to the website. You can talk to Dr. King right now. This will be on my Facebook page later this evening. Let's check on